Welcome everybody to our conversation series Researchers for Society, hosted by Swinburne's Department of Social Sciences and the Centre for Urban Transitions. So this is all part of our series for Social Sciences Week 2020, which is September 7th to 13th. My name is Dr. Sal Clark. I'm a lecturer in politics and sociology, and today I'm going to be interviewing Mozhgan Moarefizadeh, who is the co-founder of the Refugee and Asylum Seeker Information Centre in Jakarta. So we're just going to have a bit of a chat about some of the things her organisation has been doing to respond to COVID and respond to some of the current crises that are unfolding in Indonesia. So Mozhgan is a human rights advocate, public speaker, and legally trained refugee law paralegal with a bachelor's degree in English teaching and translation. In 2013, Mozhgan came to Indonesia with her parents and her younger brother. Over the last few years, she's become increasingly involved in supporting the refugee communities in Indonesia, first as a trained interpreter with the American University of Cairo, assisting the Swadika Legal Aid Program of the Jakarta Legal Aid Centre. Then as a paralegal assisting asylum seekers with draft applications for asylum and supporting the work of international refugee lawyers in Indonesia. She speaks 4 languages: English, Bahasa, Dari, and Bahasa Indonesian. Mozhgan is also the co-founder of the Refugee and Asylum Seeker Information Centre, a member of the Jakarta Refugee Network, a founding member of the Jakarta Refugee Advocacy Network, and she also coordinates multiple programs in support of refugee communities in Jakarta, including things like helping refugees and asylum seeker communities gain access to hygiene and food packages, eye and dental healthcare clinics, as well as connecting individuals with medical assistance and responding to legal aid inquiries. She writes for publications and speaks at events, seminars, and conferences internationally. Mozhgan is also a refugee recognised under UNHCR's 1951 Refugee Convention and is currently stranded in Indonesia without any legal rights. So, Mozhgan, I first heard about you and your story when I was researching some of the situations that asylum seekers and refugees were facing in Indonesia, kind of going back a number of years now. Obviously, for the people listening at home, Indonesia is a significant transit country, which means that it doesn't actually resettle refugees. There is an agreement with the UNHCR and the Indonesian government to allow for refugee application processing in the country, and asylum seekers and refugees are generally allowed to remain in the country whilst this processing takes place. But there is no possibility of permanent integration into the Indonesian community. And this is what makes Indonesia a transit country, because for asylum seekers and refugees who enter this space, most people know that sooner or later they're either going to have to return back or find a way of moving forward. And this causes some serious problems in a situation where less than 1% of the world's refugee population are resettled annually through these kind of UNHCR-sponsored programs. So this means that the wait and the time people spend in Indonesia can be incredibly long and protracted. And it's within that protracted context that people encounter a number of social and political issues. So the UNHCR works alongside the Indonesian government to process asylum seeker claims. There's a commitment not to forcibly repatriate asylum seekers and refugees whilst they undertake this process. But the conditions can be considered kind of quite hostile for many people. So some of the major challenges that asylum seekers and refugees have identified during their time in transit in Indonesia is obviously the length of time of processing. This is probably the number one concern that most asylum seekers and refugees will talk about. We're talking anywhere between 5 to 10 years waiting from that initial meeting with UNHCR to potential resettlement. And of course, that resettlement is never guaranteed. So there is a huge insecurity during that time. It's no guarantee that people will ever be offered a humanitarian place in a third country. Then during this time, there is the issue of a lack of status. People don't have rights whilst in Indonesia. And this includes political rights, but also things like the right to work or the right to go to school. And this creates a population that is incredibly marginalized and in stasis. So it's not like normal life is just proceeding during these times. The lack of work rights obviously has many implications, including creating a kind of material deprivation for people who might struggle to find appropriate housing, even be able to create a, diet, a healthy diet for themselves, get appropriate, nutrition. And as one of the things that I'm sure you're going to speak more about, like things like just getting basic access to medical care, being able to look after themselves and their families, and things like access to education. If you are there with a young family and it's 5 to 10 years, that's an entire education that a young person might be missing out on during this period of insecurity. And of course, this is all kind of in the context of being quite vulnerable. So physical safety is often a thing that a lot of asylum seekers and refugees will talk about. Not having those kind of legal rights, not really being recognised by the state, places people in an incredibly vulnerable situation where they're kind of easy to exploit. So there is a lot of different issues facing asylum seekers and refugees during this really protracted time that is spent in transit. I didn't want to go into too much detail because I'd prefer to hear from Mozhgan, but I guess the reason why I say that there's these big gaps is to point out that over the last few years, one of the biggest changes that has occurred in Indonesia that has actually been a wonderful privilege to watch is the way that refugee-led organizations have actually stepped in to fill this void that's been vacated by governments and NGOs and even the UN to, some respects. Refugee-led organizations have stepped in and started providing this care, this immediate care to the communities themselves. And they've been the best place to actually know what those needs are. And this is where we come to your story, Mozhgan, because you have been one of the key leaders in this to the point where you've now built up an international reputation for the good work that you've been doing. So I just wondered, first of all, if you wanted to speak at all about any of that before moving on to talking about how you and the Refugee and Asylum Seeker Information Centre has responded to the kind of latest crises of COVID-19.
Thank you, Sal, for all that introduction and explanation. You made my work very easy now. Well, we started as an information center mainly back in 2017 because there were lots of refugees who didn't know where to get accurate information from, especially in their own languages. So we stepped in to respond to that basically, especially for legal aid and how they want to get through their UNHCR process until resettlement. But then the more we were going out and seeing the community, there were more requests and more needs around, more gaps that we saw that we needed to fill and nobody else was filling. So we came together with a few other refugees and tried to, with the knowledge of English that we had, tried to reach out to people outside of the country to see what resources we can find to fill those gaps. And also from within the country that we are in now, from the community around us, we tried to find any resources that we could use to fill up those gaps. And that's how we created medical care programs with the help of Indonesian doctors around to be able to support refugees here. The impact of COVID-19 has been quite bad on refugees, I can say. Well, in Indonesia, as we all know, there is a large population of people already that are badly impacted by this, and the numbers are very, very high. For refugees, 1/3 of the population of refugees in Indonesia are under the care of IOM, International Organization for Migration, and they are living in shelters, but they are crowded shelters. So if 1 or 2 cases, appear in that shelter, it's really difficult to stop that from spreading. So that's like a massive concern. There is another community of refugees who are basically homeless, living in the west part of Jakarta in one building that used to be a disused military compound. So there are about 250 refugees living there now, and there has already been 2 cases recognized there. So it's been really difficult for them to be able to have access to healthcare or to be able to self-isolate. Obviously, when you're living in a very overly crowded shelter, it's really impossible to do self-isolation. Refugees and asylum seekers already has been under a type of lockdown. Basically, we're not allowed to do anything in this country, so all we're allowed to do is to live here. So most of the time we are at home. We're not really going out doing much, in the sense that you go out for work or study or things like that, like a normal person would do. That's why I always describe my life as, I was always under lockdown, and it's like I had lots of practice, and the rest of the refugees as well. And with COVID-19, it just became doubled. So if, let's say, people could go out for grocery shopping before and feel safe with it, now they can't even do that simple task. So it just makes the struggle even more difficult. And then, like you explained, there are a few refugee-led initiatives here that those refugees are a lot more active. They are interacting with different stakeholders and organizations, or the implementing partner of UNHCR in healthcare, CWS, Church World Service. They used to interpret for those organizations or do more volunteer activities to be able to help the community, and at the same time, just be active and help themselves in some way too. But now they can't do that because all of those activities have been stopped. They can no longer interpret for those organizations, or they can't teach at learning centers. Everything was shut down for a long time until recently. Some of the learning centers have switched their system online, so some of the teachers can start their activity. But again, it's been a challenge because kids also don't have access to laptops and phones to be able to attend school online. And these schools that I'm talking about, all refugee learning centers, just a community of refugees gathering together to teach each other things informally. It's not like a very formal, high-level education. It's just very basic.
Has UNHCR been communicating with any of the refugee-led organisations or the community more directly about responses to COVID? Is there been information on how to stay safe?
There has been some information going around from several organisations like SUACA. SUACA is also an organisation that provides legal aid too. So they have been sharing some basic information on COVID-19 in different languages with the help of refugees interpreting them and translating their slides. But there hasn't been a massive, information set of COVID-19 situations in Indonesia. There isn't much updates. Even for citizens themselves, there isn't many sources of information, let alone for refugees. Yeah. UNHCR has been doing several, activities to respond to COVID-19, just same as refugee-led organizations are doing. So they have been distributing some masks that were donated. They have been distributing some clothing by a clothing brand that have been, donated. As far as that, they have been in touch with refugee-led organizations to distribute those aids.
I imagine it's incredibly challenging. So much of the information throughout the refugee networks in Indonesia seems to be managed informally anyway. Yeah. Do you find, just from the people you're talking to and the conversations you're having, do you feel like the refugee communities are gaining the information that they need in how to take care of themselves in this current pandemic?
Information going around the community. So people are very concerned. They're very scared of getting this sickness. They're scared that it might impact their process. They are scared that, for their health as well, because refugees generally don't have a very good immune system, or they're not very, very healthy in general. So they're more prone to getting sicknesses just normally. And now with the COVID-19, of course, the concern has been more. And obviously it impacted on mental health as well.
How has the Refugee and Asylum Seeker Information Centre responded to some of these challenges posed by COVID? And if you could speak a little bit about just some of the incredible work you were already doing and how maybe that's become even more central in the current climate.
Yeah, so the work that we already was doing, mostly basic needs, basically, because people need it right now. They can't go out. They can't really be active, do anything for themselves. And even for the refugees who used to receive some sort of support from other people outside of the country, now they can't do that with COVID because a lot of people have problems, so they can't really support them. If they had family, let's say in Australia or in another country who would support them on a monthly basis, now they can't do that because that family themselves also are facing the same issue. So it's just more difficult for them. It's really more difficult for them to provide for their basic needs. So REAC has been doing hygiene kits and food packages for a very long time since we started the organization in 2017. But with COVID, obviously we had to do it more. So we reached out to different partners, different donors outside the country, inside the country to see what we could do. And since the beginning of the year, since January, we partnered with IES, which is a local church who has branches in, outside of the country as well, and some other donors. to provide more of these hygiene kits and food packages for refugees. So hygiene kits and food packages provide the needs of one person for a full month, even a bit more. We try to be a bit generous with the items in it. The items are customized for the refugees, for their needs, to make sure that they have access, to keep themselves clean and keep themselves fed for a month. So we have been doing about 450 up to 500 packages per month now since the beginning of the year. So we went a bit over 5,000 packages by now. So we're hoping to make it at least 7,000 by the end of the year.
That's incredible. How many volunteers do you have currently?
Hundreds. From the refugee community.
Yeah, just the operational side of that.
Yeah, we do have project managers and volunteers from the community themselves. So they all manage it together, and they are a group of refugees that have been self-isolating together. So it's safe to do the program. They're all in one place. So it's really safe to do it.
Has the UN or, the UNHCR or any of these other partners within Indonesia, have they kind of stepped up their response? Or is this, again, just falling to those refugee-led organizations to lead the way?
Not much that I can see a massive impact, but there has been one implementing partner called the CRS, the Catholic Relief Service, that have been providing financial support for refugees. For, I think, a group of like nearly 500 refugees, they've been supporting them monthly. The ones that are really vulnerable have no type of support at all. And during COVID, there has been an emergency COVID-19 support, a one-off payments that would support refugees, and it varies from family to family, person to person.
And just more for the people listening along to this, I'm assuming that refugees and asylum seekers have been excluded from any government support packages that have been rolled out in Indonesia?
Yes. Yeah.
Which again makes this work even more timely and important.
It is, definitely, because there's no other support coming from anywhere.
Yeah. How has social science research informed the kind of work that you and your organisation has been doing? And I guess more importantly, what further research do you think is needed in this space in order to fully understand the issues that asylum seekers and refugees are facing in transit countries? And, what kind of knowledge would be useful in tailoring your response?
There hasn't been much research around the work that we are doing because we are organizing for ourselves within the community, and from outside people don't really know what we are doing. So I think definitely more research is needed, more coverage on, the work that refugees are doing here within the country is needed, so that potentially we can get some more support from outside of the country. From within the country, like I receive emails from different universities that would want to know about the type of work that we are doing within Indonesia. Like a lot of students are interested in the work that we are doing, but then once we talk to them, that's it. Like nothing happens afterwards, really. So I think it will be really helpful if once these students or other people, especially the younger population, when they're doing research on refugees, at least some action could happen after that, like more awareness for this, subject could happen. But so far, the response that we have been getting is quite negative. The Indonesian population are quite hesitant to do something for refugees because they're scared, or they don't have enough information. There isn't much information around it. So they're very hesitant to do something for refugees.
What would you want to see governments doing in order to support your work, but also just more broadly, refugees and asylum seekers in Indonesia? And I guess this can be like the Indonesian government, but not just Indonesia, the whole regional framework that's in place.
Well, the Indonesian government alone, they are facing a massive problem with their own population right now. So it's quite out of expectation if I can say, we want the Indonesian government to support refugees. I don't think that would happen anytime soon, or if ever, because of all the years that we have been seeing the programs that have been running, or the research that they have been doing around this topic, and how the treatment of refugees have been during all these years. But the least that we can expect is at least the similar treatment between refugees and the citizens, where they are receiving COVID response help, like healthcare. If a refugee is positive or they need testing, the referral system is really different with a citizen. It has been difficult to be able to refer refugees, to be able to get them tested. It's been really a challenge to do that. So if at least that could be accessible for refugees, then that would be really helpful. There are cases of refugees with positive COVID that have been finding a way to test themselves, not free of charge, of course, they had to pay for it, but then they have been sent back home with a positive result within the community. So they're infecting other people. So that has been really challenging. So I hope that, the government can take care of that, because if refugees are infecting other people in the community, or if Indonesians and refugees are hanging out together, this could become even worse. So I'm expecting that at least the government would do something about COVID, if not doing anything for responding to refugees' needs themselves.
Yeah, and I think this is a universal lesson too. We're seeing that even in Australia, that, when it comes to the health of the entire population, you're only as strong as your most vulnerable community members. So exactly. I think, yeah. And, but I was just wondering, what would justice look like for the people that, you serve and the people that you work with in the context of COVID-19?
Like exactly the example that I just said, like for testing, it's just a very simple example. Like testing should be the same for an Indonesian person and a refugee. I don't think that it should be any different, or they should be undergoing a different process to be able to get tested or receive help when they are positive. Like they should be able to get isolation. They should be able to get all the treatments that another person is getting. I think at least that one should be the same. So
just the basic treatment, the same that you would expect of any citizen of any nation state.
Exactly, like the minimum.
Yep. Is there anything else that you would like to add or comment upon?
Okay, so REIC has been doing a lot of clinics, especially eye clinics, because there is no one else that is providing that support for refugees for, free of charge. So it's been one of the most important programs that people are asking for it all the time. They request it all the time. Also, that dental care is another big one that people need, and REIC is able to provide that. Then basic needs like hygiene kits and food programs are a continuous need throughout the months, and more refugees are requesting it, especially with COVID-19 now. So the biggest part of our focus now is on that, to make sure people can keep fed and safe inside their homes for this period of time. And then the other program that we're doing is legal aid and information for a lot of refugees, especially because now countries have cut down on resettlement numbers. Australia is not resettling anyone from Indonesia anymore. The US has cut down on their numbers. So the only hopes are for now, like New Zealand, Canada, and they're mostly with the sponsorship programs, which RAC again is doing information on that. And there are fundraisers around the community for people who are the most vulnerable and can possibly, get a space to be sponsored by a Canadian and possibly be resettled, because resettlement times have increased from 5 to 10 years up to 15 or 20 years even. Yeah. So it's really uncertain and unexpected.
And of course, we'll put a whole bunch of links in the comment section below for anyone listening along and wanting to know where they can go to donate to some of these initiatives and, get involved, or even just learn more about it and what's happening over there. All right. So thank you for everyone listening along at home. Like I said, we'll make sure all those links are available if you do want to learn more and get involved and even donate. That would be great. Thank you, Mozhgan, once again for sharing. It's always a pleasure to talk to you and hear about all the incredible things that you're doing. And I hope you're staying safe and that your family is all well.
Thank you. Thank you for having me.